How can I differentiate between normal discharge and abnormal discharge?
Hello everyone. Today, we're going to talk about a topic that might be a bit sensitive for some, but is incredibly important for all individuals with a vagina to understand: vaginal discharge. We'll discuss the difference between normal and abnormal discharge, what each can indicate about your health, and when you should seek medical advice.
What is normal discharge?
First, let's discuss normal vaginal discharge. Normal discharge is a natural part of the menstrual cycle. It can vary in color, consistency, and volume at different times throughout the cycle. In general, normal discharge may be clear or milky and has a slight odor. Its consistency can range from sticky and elastic to creamy or watery. Discharge is influenced by hormonal changes in the body, so it's common for it to change throughout your menstrual cycle. For instance, there might be more discharge around the time of ovulation, or it may become thicker and stickier just before your period.
What is abnormal discharge?
Next, let's move on to abnormal vaginal discharge. There are several signs that your discharge might be abnormal. 1. Color. Abnormal discharge can be green, gray, or frothy, and may be yellow or blood-tinged when not associated with menstrual bleeding. 2. Odor. An unusually foul or fishy smell is often a sign of infection, like bacterial vaginosis or trichomoniasis. 3. Consistency. If the discharge is much thicker than usual, almost like cottage cheese, that might indicate a yeast infection. 4. Volume. Suddenly having much more discharge than usual can also indicate a problem. 5. Accompanying symptoms. Itching, burning, discomfort, or pelvic pain in conjunction with changes in your discharge may suggest an infection or other medical condition.
When to seek medical advice?
It's important to remember that everyone's body is unique, and what's normal for one person might not be normal for another. If you notice changes that seem out of the ordinary for you, particularly if they persist or are accompanied by other symptoms, it's always a good idea to talk to a healthcare provider. This includes times when you have abnormal discharge, as we described above, or if you have other symptoms like pelvic pain, discomfort during sex, frequent urination, or other urinary symptoms. These could indicate conditions such as sexually transmitted infections, bacterial infections, or even hormonal imbalances, all of which need medical attention. That wraps up our discussion on how to differentiate between normal and abnormal vaginal discharge. Remember, understanding your body is a crucial part of maintaining your overall health. Don't be afraid or embarrassed to seek medical advice if you notice anything that concerns you. It's always better to be safe than sorry. Thanks for watching, and take care.